Hantavirus, also known as the virus, is a family of viruses that belong to the Bunnyviridae family. It is named after the Handan River in Korea, where it was first identified during the Korean War in 1950. The virus is primarily transmitted to humans through contact with rodent urine, feces, or saliva, as well as through inhalation of aerosols containing virus particles. Hantavirus infections can manifest in various forms, including hemorrhagic fever with renal syndrome, HFRS, hantavirus pulmonary syndrome, HPS, and hantavirus cardiopulmonary syndrome, HCPS. HFRS is the most common form of hantavirus infection, accounting for about 90% of cases. It is characterized by fever, muscle aches, headache, and fatigue, followed by kidney failure, which can be life-threatening if not treated promptly. HPS, on the other hand, primarily affects the lungs and is less common, with only about 10% of cases resulting in this form of the disease. It is characterized by severe respiratory distress, shortness of breath, and fluid accumulation in the lungs. HCPS is a rare and severe form of hantavirus infection that affects both the heart and lungs, leading to respiratory failure and cardiac arrest. The incubation period for hantavirus infection ranges from 2 to 5 days, with the symptoms typically lasting for several weeks. The virus can be transmitted from person to person, although this is rare and usually occurs in healthcare settings or among close contacts of infected individuals. The risk of transmission is higher in settings where there is close contact with infected individuals, such as in hospitals or during childbirth. Hantavirus infections are more common in certain regions of the world, including the southwestern United States, the Andes Mountains of South America, and parts of Asia. In the United States, the dominant form of hantavirus infection is HPS, which is primarily associated with exposure to the deer mouse, Paramyscus maniculatus. In South America, the virus is primarily transmitted through contact with rodent urine, feces, or saliva, and can cause both respiratory and hemorrhagic forms of the disease. Prevention of hantavirus infection involves avoiding contact with rodents and their excreta, as well as practicing good hygiene and sanitation. Vaccines for hantavirus are not currently available, and treatment is primarily supportive, focusing on managing symptoms and supporting organ function. In severe cases, mechanical ventilation and dialysis may be required to support life. In conclusion, hantavirus is a family of viruses that can cause a range of severe and life-threatening illnesses. The virus is primarily transmitted through contact with rodents and their excreta, and is more common in certain regions of the world. Prevention and the treatment of hantavirus infection involve a combination of avoiding contact with rodents, practicing good hygiene, and supportive care in severe cases.